Why your tendons never heal. The persistent myth that a strained tendon will miraculously mend itself within a mere 36 hours, a notion often repeated by enthusiastic gym-goers pushing their limits, unfortunately leads many down a path of prolonged discomfort and chronic injury. This aggressive mindset, ignoring the body's intricate healing mechanisms, frequently transforms what might have been a minor, transient tweak into a debilitating, year-long struggle. Consider for a moment the profound frustration when an elbow, once robust enough to effortlessly power through countless pull-ups, now protests vehemently at the simple act of twisting open a jar, leaving one to ponder the mysterious origins of such sudden fragility. The fundamental understanding of our tendons is crucial to comprehending this shift from functional strength to unexpected vulnerability. Tendons are far more than mere passive strands. They are dynamic, incredibly vital connective tissues primarily composed of collagen, a fibrous protein renowned for its immense tensile strength. While often conceptually grouped with ligaments and fascia due to their shared connective tissue nature, each performs distinctly specialized roles within the body's complex musculoskeletal architecture. Ligaments, for instance, are the sturdy biological ropes that link bone to bone, providing stability to joints. Fascia, a widespread network of connective tissue, envelops and interpenetrates muscles, bones, and organs, providing support and facilitating movement. Tendons, however, serve the critical function of connecting muscle to bone, acting as the indispensable cables that translate muscular contraction into skeletal movement. When our muscles engage, contracting with varying degrees of force, that energy must be efficiently transmitted to incite motion. This vital transmission occurs through the tendons, which then pull on the bones, initiating every lift, every throw, every step, and indeed, virtually every physical action requiring the coordinated effort of our skeleton. This indispensable role necessitates that tendons possess an absurd degree of inherent strength and resilience. The structural integrity of a tendon is a marvel of biological engineering. Each individual tendon is meticulously organized into hierarchical bundles. Within these primary bundles, even smaller bundles are intricately arranged, and within those, yet smaller bundles, continuing this nested pattern until we reach the fundamental building blocks, the actual collagen fibers themselves. This structural organization is often likened to a robust braided rope, or, as some might humorously describe it, like a biological inception, where layers of bundles progressively reveal the core collagen fibers undertaking the strenuous work. In a healthy, uninjured tendon, these collagen fibers are not only densely packed, but are also aligned with extraordinary precision, running perfectly parallel to one another. This immaculate parallel arrangement is the cornerstone of their remarkable strength and ability to withstand significant tensile loads. However, when a tendon sustains an injury, this highly organized parallel structure begins to unravel. The once orderly fibers become scattered, disoriented, and haphazardly arranged, compromising the tendon's ability to bear stress effectively. Beyond their structural strength, tendons also possess remarkable elastic properties, enabling them to function much like biological springs. This elasticity is particularly evident during movements such as jumping or running. As we land, our tendons absorb and store kinetic energy, much like a stretched spring. Then, during the subsequent upward push or propulsion phase, they efficiently release this stored energy, contributing to powerful and economical movement. This elegant energy-releasing mechanism is a testament to the body's incredibly efficient biomechanical system, a system designed for repeated loading and sustained performance, that is, until it is pushed beyond its adaptive capacity and begins to falter. Tendons are inherently built to withstand and adapt to repetitive loading, a process known as mechanotransduction, where mechanical stimuli are converted into biochemical responses that strengthen the tissue. However, there is a critical threshold. When the applied load becomes excessively intense or prolonged without adequate recovery, the tendons experience overwhelming stress. This excessive strain initiates the formation of microscopic tears or microtrauma within the collagen fibers. In most instances, given sufficient rest and recovery, the body possesses an innate capacity to effectively repair these minor tears, restoring the tendon to its original state. The critical problem arises when an individual continues to stress the compromised tendon before it has had ample opportunity to fully repair itself. In such scenarios, the rate at which new damage accumulates begins to outpace the rate of biological healing, setting the stage for a chronic and escalating injury cycle. Compelling scientific studies have shed light on a crucial aspect of tendon loading. After approximately 10 minutes of continuous high-intensity loading, the tendons appear to cease receiving the beneficial signals that stimulate strengthening. Beyond this point, further loading primarily results in the progressive accumulation of additional damage without yielding any discernible adaptive benefits. This means that engaging in an activity like free solo climbing an immense structure such as Taipei 101 under the misguided assumption of continuously building tendon strength throughout the ascent is based on a flawed premise. The peak for beneficial tendon adaptation might have been reached within those initial 10 minutes, with subsequent efforts contributing more to breakdown than buildup. It's a sobering realization that one's body has distinct biological limits, and understanding these limits is paramount for injury prevention. This often leads to a crucial moment of self-reflection, the stark realization that not everyone possesses the superhuman endurance or genetic predisposition of an elite athlete. Ignoring the subtle aches and nascent clicks in one's joints is a perilous gamble. Tendon injuries are not confined to specific areas. They can manifest almost anywhere. A tendon connects muscle to bone, commonly affecting the elbow, shoulder, rotator cuff tendons, Achilles tendon, patellar tendon, jumper's knee, and gluteal tendons, hip pain, among others. These injuries frequently arise from a combination of factors, including consistently poor movement mechanics, improper form during exercise, or the application of excessively high training volume or intensity without adequate progressive overload and recovery. When a person finally seeks professional medical consultation for persistent tendon pain, they are likely to encounter specific diagnostic terminology. An acute injury characterized by recent onset and noticeable inflammation is typically diagnosed as tendinitis. This term, with its itis suffix, signifies inflammation. Conversely, if the condition has been present for a more extended period, often because the initial symptoms were ignored or inadequately addressed, it is generally referred to as tendinopathy. This broader term acknowledges a more complex pathology that goes beyond simple inflammation, often involving degenerative changes within the tendon structure. It's important to understand that the inflammation experienced in the early stages of an injury is not inherently bad. It is, in fact, an integral part of the body's natural healing process. This inflammatory response serves to increase blood flow to the injured area, delivering essential repair cells, growth factors, and nutrients necessary for tissue regeneration. The true core problem, however, lies in the repeated re-injury of the tendon before this critical healing and remodeling process can reach completion. Each subsequent stressor disrupts the fragile repair efforts, perpetuating the cycle of damage. Effectively addressing a tendon injury often begins with judicious activity modification. This does not necessarily imply a complete cessation of all training or physical activity, which can sometimes be counterproductive. Instead, it involves intelligently identifying and temporarily discontinuing or significantly modifying the specific movements or exercises that are directly contributing to the tendon's ongoing destruction. For instance, if a particular elbow flaring push-up variation is consistently aggravating the tendon 3 times a week, that specific movement should be paused or adapted. The initial repair phase for a tendon might indeed begin within a few days, involving the cellular cleanup of damaged tissue and the laying down of preliminary collagen. However, the complete, robust healing, remodeling, and strengthening of the tendon, where those collagen fibers are properly aligned and integrated, is a much more protracted affair, typically requiring anywhere from 6 weeks to 6 months, and in severe cases, even longer. This timeline starkly contrasts with the aspirational 36-hour recovery often cited in casual gym talk. The intricate biological processes of tissue repair operate on their own immutable timeline, entirely unconcerned with upcoming beach vacations in 4 weeks or impending athletic competitions. Patience and adherence to biological principles are paramount. One of the most evidence-backed and effective interventions for tendinopathy is eccentric exercise. This specific type of training involves movements where the muscle is lengthened under load, such as the controlled lowering phase of a bicep curl, the descent phase of a squat, or slowly lowering oneself during a calf raise. The efficacy of eccentric loading stems from its unique ability to promote the proper alignment of collagen fibers as they are being rebuilt and remodeled. By applying controlled tension during the lengthening phase, these exercises encourage the new collagen to lay down in that desired parallel direction, preventing the formation of a tangled, disorganized mess of fibers that would otherwise compromise the tendon's strength and function. This mechanotransduction signaling is critical for optimal tissue repair. In conjunction with targeted eccentric loading, many progressive medical professionals and physical therapists now advocate for a multifaceted approach to tendon rehabilitation. This often includes carefully controlled movement, gentle stretching, and specific massage techniques applied directly to the healing tendon. The overarching goal of these modalities is to actively guide the healing collagen fibers into that organized parallel structure rather than allowing them to deposit randomly and haphazardly. Movement, even gentle, promotes blood flow and nutrient delivery, while stretching, when performed appropriately and not excessively, can help maintain range of motion and influence fiber alignment. Targeted massage, such as deep transverse friction massage, can also stimulate cellular activity, break down adhesions, and further encourage organized collagen deposition. Ultimately, a significant proportion of tendon injuries, particularly those stemming from athletic or exercise-related activities, can be traced back to fundamental errors in training methodology. These commonly include a failure to learn and consistently apply proper form for exercises, a tendency to skip crucial progressive steps in training programs, or an eagerness to attempt advanced movements for which the tendons are simply not adequately prepared. For instance, attempting complex gymnastics rings movements without first building foundational strength and tendon resilience through more basic bodyweight progressions is a recipe for disaster. This premature ambition often results in the unfortunate scenario of being sidelined, nursing an injury with an ice pack on the couch, wondering what went wrong. Comprehensive resources, such as specialized calisthenics playbooks, are invaluable precisely because they meticulously break down movements into visual, sequential progressions. These resources don't merely instruct one to do this exercise, rather, they provide a roadmap for systematically building the specific strength and resilience that tendons require before advancing to the next level of difficulty. By clearly illustrating proper form and the necessary preparatory steps, they help individuals avoid the tempting but dangerous shortcuts that invariably lead to injury and prolonged recovery periods. The intricate world of tendons is far more complex than simple elastic bands, encompassing a sophisticated interplay of biomechanics, cellular biology, and adaptive capacity. It's imperative that individuals acknowledge and address the persistent clicking sounds, grinding sensations, or nagging aches that emanate from their joints, rather than dismissing them with the same casual indifference often reserved for accumulating credit card bills. Ignoring these vital signals is a direct path to chronic issues. When confronted with persistent tendon pain, the most prudent course of action is to seek the expertise of a qualified orthopedic doctor or a sports medicine specialist. Relying solely on generalized online advice or AI-generated diagnoses, while potentially convenient, cannot replace the nuanced assessment and personalized treatment plan offered by a medical professional. A proper diagnosis is the cornerstone of effective recovery, allowing for the development of a tailored rehabilitation plan that addresses the specific nature and severity of the tendon injury. This professional guidance ensures that interventions are appropriate, progressive, and geared towards long-term healing and injury prevention. The unshakable truth is that a tendon will not miraculously heal in 36 hours, regardless of one's personal motivation, willpower, or demanding schedule. Biological repair processes unfold at their own pace, dictated by cellular turnover and tissue remodeling. However, by genuinely respecting this biological process, diligently adhering to a prescribed rehabilitation program, embracing patience, and consistently putting in the necessary, often challenging work, one significantly enhances the likelihood of returning to full activity. This commitment could mean being back to training 6 months from now, stronger and more resilient than before, rather than being confined to the couch with an ice pack, grappling with regret and the lingering question of what could have been done differently.